I just have a little time to talk to you about CBT therapy. What is CBT? CBT, it's a structured timeline and goal-oriented psychotherapeutic approach. It focuses on the relationship between thoughts, feelings, and behavior. The goal is to identify and challenge unhelpful, distorted thinking patterns, cognitively, and replace them with more realistic, adaptive thoughts and behavior. That's what CBT is. Thoughts, feelings, and behavior are interconnected. Our thoughts directly influence or how we feel and act, present focused and problem oriented. CBT concentrate on past and current problems rather than just past issues. Usually CBT is short term, lasting between 5 to 20 sessions. It's collaboratively and it is active participation with the therapist and the client. The therapist and the client work together as a team. Treatment CBT provides changing negative thinking patterns, anxiety disorders, addressing catastrophic thinking, avoidant behaviors, post-traumatic stress disorder, and it also is CPTSD. You have PTSD and you have complex PTSD. You also have reframing traumatic memories and reducing and avoidance of triggers, obsessive compulsive disorder, challenging intuitive thoughts and reducing compulsive behaviors, substance addiction, process disorders. We use CBT in terms of addressing triggers and building healthier coping strategies. A negative mind will never allow you to have a positive life. Cognitive restructuring helps clients to identify and challenge cognitive distortion. Another thing about CBT is that it replaces irrational thoughts with more balanced, evidence-based thinking. Behavioral activation encourages clients to engage in activities they enjoy or find meaningful, especially when feeling low, and I just talked about that. Exposure therapy is one of the things that we do. We have mindfulness. We have encourages clients to stay present and observe thoughts and feelings and in a non-judgmental way. That's what we do. This is the pattern of people when they're traumatized. The first thing that we do is we think negative about ourselves. And the more negative thoughts keep coming, is the more your body would react to these negative thoughts. It's the more your behavior, because of the fact that a lot of times people don't know how to self-regulate. That's one of the big problems about us. There is a stronger link between childhood trauma and addiction than there is between obesity and diabetes. 2/3 of addicts report being abused as children. That means that the war on drugs is a war on traumatized people just needing help. All these thoughts you have, if you can see them, assuming that you are not safe, assuming that no one is there for you, all these thoughts will produce a protective behavior. All of them. You talking about avoiding thinking about your own negative emotions and refusing to trust others and all these things, tuning in the negative and tuning out the positive, or black and white thinking or doomsday thinking, and I like this one, people say, you've been traumatized by the shoulda, woulda, coulda. I shoulda do this, if I only had the time, I shoulda do this, I coulda do this, and you know what, if she or he only had done this, I woulda do this. just traumatized by the shoulda, woulda, and coulda. And the shoulda, woulda, and coulda basically keep us up at night. Oh man, how did I actually blow that interview? I shoulda do this. I coulda do this. I woulda do this. Here is, and that's just basically the thoughts. The body is about poor sleeping habits, poor dieting, use of harmful substances, no or limited exercise, pushing your body too much or too exercising and so on and so forth, ignoring your body in terms of visiting the doctors and so on and so forth, self-harming, poor hygiene and so on and so forth. That's maladaptive way that we cope. What we have is the maladaptive behavior patterns, and that is avoiding necessary daily activities, like being getting so anxious that you're frightened to open the mail, or pick up your phone if you see an unknown number, getting stuck into addictive behaviors, purposefully avoiding taking care of yourself or restricting food and so on and so forth, acting aggressively. This is a big one. Acting aggressively to distance others, avoiding family and friends, taking care of other people. Taking care of other people to avoid your own problems. Avoiding having experiences that are positive or pleasurable. Using controlling behaviors to avoid feelings. And all these things are maladaptive behaviors. Now here is what we ask to do. What are maladaptive behaviors? They are models that develop in relationship that acts as a blueprint or instruction manuals that reflect our beliefs about ourselves and about others and about how relationship works. They guide our expectation, feeling, and behavior in relationship. Here is what they do. They are initially formed in our early environment in context with a relationship with our parents or caregivers and our experience in our family. We learn to think, do, and feel what allows us to be successful and to keep us safe in these situations. So it starts very early. Relationship models we develop early in life continues to play a central role in shaping our thoughts, feelings, and behavior in ways that we may not be aware of or notice, and we bring them into adulthood and apply them to our lives. Emotions will come. Anxieties will come. We teach people how to basically emotional surf. Ride on top of the wave instead of being a tidal wave of emotions that sweep you away. We're going to also teach clients the positive imagery and reframe certain things. We're going to do focused breathing under the body. We're going to basic self-care, teach them how to soothe their senses and progress muscle relaxation. And what we're going to do is mindfulness-based and exercising. We're going to do some replacement behaviors, slow down and do some replacement behaviors, opposite action, And what we also going to do is, one of the big things when I work with trauma is people asking for support. And what the last thing that we're going to teach people to do is that do something beautiful for yourself on a weekly basis, even if it's to just buy a cup of coffee, sit down in Starbucks and watch the world go by. CBT is a powerful evidence-based approach to addressing a wide range of mental health issues. By focusing on the relationship between your thoughts, our emotions, and our behavior, it empowers clients to challenge maladaptive thinking patterns and adopt healthier behaviors. CBT equips individuals with lifelong skills for managing distress, fostering resilience, and empowering overall well-being. Thank you so much.